Good afternoon. We'll be starting soon as the participants are joining.
Samanvaya. Good afternoon, all. I welcome everyone. Thank you for joining us for today's conference. Today, there are elegant speakers with us to enlighten us. Let me invite the most fascinating and fantastic, extravagant and exceptional speechmaker, Dr. Divya Prabha, co-founder, Yoga Mission, United Kingdom and International Chandramouli Charitable Trust, Varanasi, India. Ma'am, you set such an example for others. I request Dr. Dhanashri Patil, Assistant Professor, Department of Integrative Medicine, Sri Devarajas Academy of Higher Education and Research, to introduce our honorable speaker, Dr. Divya Prabha. Over to you, ma'am.
Thank you, Dr. Nuzul. I'm glad to introduce Divya Prabha, Dr. Divya Prabha, Lucy Guest, as her UK name is. Divya Prabha is devoted to yoga for life. She graduated from Oxford University, UK, with masters with honors in metallurgy and the science of materials, and started her career with top UK and American investment banks. Following life-changing experiences, she left this life behind, embarking on her spiritual journey with Brahmarshi Vishwatma Bawarchi. She has dived deep into Indian culture at Varanasi and draws on the ancient wisdom of the Vedas, Upanishads, and the Gita, which bringing the light of knowledge into the deep practices of 8 limbs of yoga in her daily life. She is traditionally trained and guided in Mahayoga, Hatha Yoga, Mantra Yoga, Laya Yoga, and Raj Yoga, as well having a traditional Sanskrit education in Varanasi for the last 14 years. And she's won the gold medal for the Shastri, which is the course which is equivalent to BA in Sanskrit, and coming top of her university class during further studies in Prachin Vyakarana on the Acharya course. So it's the degree is equivalent to the MA. She has broadcast lectures and taken part in discussions on the radio and continues to teach in India as well as internationally. She is co-founder of Brahmarshi School of Yoga and Divine Light Retreats, a Vedic Gurukul, and international NGOs promoting Sanatana Dharma, Bharatiya Sanskriti, and yoga as a way of life. With this brief introduction, I welcome you, ma'am. Over to you, ma'am.
Pranam. I hope that you can hear clearly. I'll start with Pratana. Guru Brahma, Guru Vishnu, Guru Devo Maheshwara, Guru Sakshat Param Brahma, Tasmai Shri Gurave Namaha. Oh. Pranam. And I apologize for the connection. So if I do keep cutting out, please feel free to move to the speaker. Thank you for me, particularly to deal on the samanvaya conference on the subject of wellness, holistic well-being. prepared a presentation for you today called Yoga, the Science of Stable Wisdom, that is in particular bringing the Shastras into So I'll go straight into my presentation and hope that I don't repeatedly cut out as currently happening. So the Shastras are a pure scientific basis given by the rishis, and it's not new knowledge. These days, there's a lot of over the last 100 years or so, there you could say, in a sense, that there's a revival of the yoga knowledge, yoga practice. And yoga, the word yoga is probably the most famous word in the world in Sanskrit. I think that it's reached every country in the world. But what we need to understand is that's not something new. This knowledge is thousands and thousands of years old. It's not come today, but so many thousands of years ago. Knowledge comes from a time when there were no divisions in humanity, where there was supreme consciousness, Paramatma, where the earth was our mother, and the Brahmanda, Vishwa, is our home, where humanity consisted of simply our brothers and our sisters. And these practices of yoga from suffering in order for us to experience peace and happiness, to experience unity and well-being in a temporary way, but in a permanent. And we look around us, all of these giving us information according to our ability to connect with in the past transition, some report says, yoga anushatam. In anushatam, again, I'm giving you the discipline of yoga. It means that this knowledge was coming from before. So we look to the past, we find that we told the first enunciator of yoga is her, which is experienced. The first enunciator from the beginning manifestation is expressed in the Rig Veda. So that that divinity, that manifest of sky, space, and all that exists beneath is our first teacher, yoga. And in the abundance, we have two beautiful analogies of what I feel about. First, how life is like a river flowing between the two banks of earth. And further on, the Upanishad says, Yatha nadyasya damana samudre marupe vihaya tata vidvamupapta pararupayyam. So the aim of life is to dissolve, to become absorbed in that original source of existence, that supreme consciousness, in the same way that rivers, streams flowing into the ocean become inseparable from the ocean, have
Sorry for the technical disturbance. Because of the technical issues, we are rescheduling Dr. Lucy Mann's talk. Now, I wholeheartedly welcome the genuine and perfect person who has got all the right moves. Dr. Mohan Reddy, Professor and Head, Psychiatry, Sri Devaraja's Medical College. His presence is a support and patience is an inspiration. I invite Mr. Yagla Vishwashri, PhD scholar, Department of Integrative Medicine, to introduce Dr. Mohan Reddy. Over to you, Vishwashri.
So, hold on. So, thank you for the introduction. So, first of all, I should thank all the organizers for giving the opportunity to be the part of the celebrations, the International Day of Yoga. So, though I'm not expert in yoga, I thought I'd share my knowledge of the common thing what we see in today's world, the stress among the youth, stress among all the population. We take the child, adult, anybody for the matter, everybody is under stress. So I thought I share some techniques of how to overcome this stress is common to all of us. One thing I can say with a guarantee that all of us have gone through stress. All have gone through the phase of stress. One person who has no stress on his life, his world is a dead person. So we all face stress in one form or another. So how to overcome this stress? So just I would like to touch upon a few ideas. So 15 principles I thought I'd just share with you. So So first of all, the concept, everyone wants to be healthy. We all want to be healthy. But what is health? What is health? If you look at the definition given by World Health Organization, health is defined as a state of complete physical, mental, and social well-being, and not merely absence of disease or infirmity. One more valid point, as per WHO, it says that there can be no physical health without mental health. So a person, if you look at a normal person, he has all these characteristics. He realizes his potentials. He's able to cope with the normal stresses of the life, able to work productively and fruitfully, and make contribution to his or her society in which he lives in. To attain this, he has to have all these components: resilience, self-esteem, emotional well-being, spiritual well-being, and social kindness. Basically, if you look at the definition of stress, stress is defined as the body's automatic reaction or response to any pressures or demands placed on it. So you can see the diagram representation, reaction, response, one side stress, other is stressors. The formula S app is equal to P greater than R, where P stands for pressures and R stands for the resource. Stress occurs when the pressures are more than the resource where you are able to handle it. One quote from Anthony Coffey says, anybody can face the crisis, but it's a daily living, it's best. One question I'd like to ask you on. Do you need to have stress? Is this really required for the life? The answer is yes. We all require stress. You know why? If you look at this Hansen model, initially you can say that the efficacy, if there's no stress at all, the efficacy is very minimal. You see that graph. So it's the lower end, the efficacy is almost minimal. So as stress increases, the performance also increases. It's called good stress or new stress. At one particular point where the stress is optimal, a person is able to give his best for the community. But once the stress causes more than that, it becomes distress. And the function also comes down. So stressors can be many types, can be financial, interpersonal, emotional, injury, career pressures, multiple, any illness, anything. But if you look at the positive stress, so there one is positive, one is negative. Positive stress basically it's first motivation, awareness. It creates a sense of urgency, alertness, need for survival. And negative stress, on the other hand, it contributes to chronic diseases like headaches and GI problems. And excessive stress can lead to a whole lot of physical, mental, psychological, and it can disturb the spiritual health also. Why do you experience stress? What is the reason we experience stress? See, most of the time the stress we experience is self-generated. How I perceive my life depends a large extent on how I perceive the world. So basically, how I see the life depends a lot on how we perceive ourselves. When we perceive ourselves, that's why the way we perceive the world also. You ask somebody on the stress, he'll say, I'm very anxious, I'm fearful, I'm frightened, I'm sad, dull, depressed. These are stress feelings. And symptoms can be varied in physical symptoms, mental, emotional, and behavioral symptoms. Physically, they can have multiple aches and pains, body pains, joint pains, particularity, and so on. Mental symptoms, they can have lack of concentration, memory lapses, and difficulty making decisions. The emotional symptoms can be impatience, fits of rage, and tearfulness. And behavioral symptoms, they can start abusing alcohol, drugs, smoking, appetite changes, disturbed sleep, restlessness, agitation, and violent behavior. One important very point I want to highlight here is 80% of all the modern diseases have the origin in this stress. Take BP, hypertension, diabetes, stroke, asthma, all have the origin in stress. How to manage the stress? This is where I want to highlight. I want to give you the 15 formulas. A simple formula, all you know. I just want to re-emphasize those formulas. How to handle the stress effectively. One thing I want to say, no one can calm the ocean waves. But with stress management technique, we can learn to serve the ocean in a smooth way. So you have to change the way of thinking, change your behavior, change your lifestyle. Thinking involves three things. One is reframing, positive thinking, and problem solving. Reframing is basically it changes the way you look. Any stressor, you feel better. See, for example, a student is there, he's got exams. The moment you say exams, he gets very panicky, fearful, stress. Instead of looking at exam as a stressful event, why can't you look in a different way? Like, okay, the exam we conducted to know my level of knowledge, to know the level of understanding. In this way, the student is able to perform better instead of taking exam as a big stressor. So the whole concept of cognitive reframing is basically looking at the stressor in a different way. Don't see exam as stressor. See it as a challenge. To look, probably know, they want to know my level of understanding, how much I understood the subject. So if you look at it in a different way, most of the stress can be manageable. And keep one thing, it helps to see things in a different light. Very important, positive. Always be positive. So focus on your strengths, learn from the stress you are under, look for the opportunities, seek for the change, and seek for the positive and make a change. Problem solving, as usual, identify the problem, generate alternatives, and implement the solution. Behavior, very, very important. The 6 features you should learn. So you should be assertive, get organized, time management, ventilation, humor, diversion, distraction. See, lack of assertiveness. What the person doesn't have assertiveness, it shows he has got low self-esteem. The key to assertiveness lies in both verbal and in non-verbal communication, meaning gesture, posture. So they hold a key for the assertiveness. Basically, the non-verbal communication, the way I communicate, the way I use my body language, my posture, the way I stand, the way I may enter the eye contact with you. Be organized, very, very important. Studies have shown that poor organization is one of the most common causes of stress. Hence, prioritize your objectives, duties, responsibilities to make them more manageable and achievable. Time management, always have time for everything. Ventilation. Basically, ventilation, you're going to share your problem with somebody very close to you whom you trust upon. It says that a problem shared is problem half. A joy shared is joy doubled. So have a close friend whom you trust upon. Talk freely, express freely, have your own network of your friends and colleagues where you can share your not only inner feelings, just to have a connectedness, the social characteristics. And sometimes you don't have any friends, you don't share those things. Have a personal diary, write those things, those diary, but don't try to read it again. Humor, always have a sense of humor. Humor, you laugh more. Laugh more, you feel much better. The ones that relax, you breathe better. It becomes endorphin to the bloodstream, which the body has a painkillers. Diverse distraction, lastly, very, very important. Whenever you face any stress, don't try to solve the problem immediately. Take time out. Get away with things that bother you. Don't try to solve the problem immediately. Relax yourself. Calm down. It helps you to think logically and come back and try to solve the problem. Law 6, lifestyle, very, very important. So diet, have a balanced diet. Balanced, healthy diet, and say no to caffeine and nicotine. Always, whenever I go to any college or school, I always highlight this point. Always say no to drugs, alcohol, and smoking because they ruin the life. I can always have the habit of exercise. At least 40 minutes exercise per day for 6 days a week. Make it fit. It improves blood circulation, lowers blood pressure, clears the mind of worrying thought, improves self-esteem, makes you feel good about yourself. Sleep, very important. At least the person should have a sleep of 7 to 8 hours per day. Because a good stress reducer, when you're tired, you can't make any decisions. So have a good sleep, get up fresh, full of energy, and try to solve the problem or what the stressor you're facing. Leisure, again, it gives break from the routine, a good stress buster, and outlet on what outlet for relief. Very important point. Relaxation, what we highlight, use PMR, there's progress was the direction, and yoga. That's where we are here today. Yoga is such a fantastic technique where you can calm the mind. Calm the mind. And the studies have shown that with yoga, simple disorders like insomnia, depression, anxiety have literally cured off. Now, yoga experts have spoken to you all about these issues. So, once I would highlight yoga is a fantastic tool given by our own country. So, we should utilize this yoga on this day and promote it to the other people also. Spread awareness about yoga and simple technique of yoga to cure insomnia, depression, is so common in psychiatric practice and meditation. So basically, by doing all these techniques, it reduces mental worries, improves concentration, lowers blood pressure, causes fatigue, promotes sleep, reduces pain, ease concentration. Last slide, I would say, I cannot be a chronic thought of giant. Please stop and once again thank the organizers for giving the opportunity to share my thoughts. So though I spoke on stress management, yoga is definitely to stress also. So in that way, by properly utilizing the yoga techniques, we can overcome stress and manage common issues of depression, anxiety, what is anxiety practice. Thank you so much. Thanks.
Thank you, sir, for elucidating regarding stress, its management, and how to change our lifestyle by implementing yoga and meditation in our lives to be away from the psychological disorders. Now, I request Dr. Malagi to hand over a memento to Dr. Mohan Reddy. Thank you, sir. Now, let me welcome the magnetic personality, Dr. Jagmohan SV, in charge head, Department of TB and CD, Sri Devaraj Arts Medical College. Introspection is his superpower and he radiates wisdom and knowledge. He is considered as the vital asset of the institution. I invite Mr. Srinivas N, PhD scholar, Department of Integrative Medicine, to introduce the legendary speaker. Over to you, Srinivas.
Thank you, Professor. Dr. Jagmohan SV, presently working as Assistant Professor, Head of Department of Pulmonary Medicine, Sri Devaraj Arts Medical College, Kollam. Also working as a Nodal Officer for National Tuberculosis Elimination Program since 7 years. Completed a course on spirometry with a distinction conducted by Chest Research Foundation, Pune, in 2014. Sir has trained many MBBS, MD, AHS and BS and PhD students in last 10 years. He has got more than 10 publications in different journals. Sir has got NAPCON Award for the best paper presentation in 16th Joint National Conference of the National College of Chest Physicians held at Agra, Uttar Pradesh in 2014. He has won second place for the best poster presentation at PulmoCon 2014, 16th State Annual Conference of Academy of Pulmonary and Critical Care Medicine at Thrissur, Kerala. He won second prize in Purdue IIT quiz conducted by Chest Research Foundation, Pune in 27th October 2012. Sir was selected for Lawrence Young Scholar Award for Pulmonary Medicine in 2014 held at Bangalore. Sir was felicitated on the World TB Day 2018 for securing first place towards treatment of TB services in Kolar district, Karnataka. Sir is also actively involved in sports activities. So Sir is a member of the sports committee, Sri Devaraj Arts Medical College. Also, state level badminton player represented the Kolar district in 2000. He is a member of Academy of Pulmonary and Critical Medicine, Kerala, PulmoCon, Karnataka, NAPCON, India, National Tuberculosis Elimination Program Nodal Officer, Kolar, Indian Medical Association, Kolar. With this brief introduction, I welcome you, sir, for a talk on the benefits of yoga and respiratory disorders. Over to you, sir.
Next, just to impress my colleague.
So good afternoon, everyone. So I thank the yoga department benefits of yoga and respiratory diseases. So myself, I am Dr. Jagmohan. Okay. Thank you. So myself, I'm Dr. Jagmohan. I am working as a consultant pulmonologist and a nodal officer for tuberculosis. So today's topic of discussion is benefits of yoga in respiratory diseases. So there is a saying in Hindu proverb, life is nothing but a series of breaths. So breath is ever present from the moment of baby birth to the last gasp of a dying man. So breathing sustains life, brings natural breathing. Natural breathing brings happiness, health, clears the mind, and calms all the emotions. So it also helps in release of vitalizing flow of energy. So suppose if that breath becomes difficulty in taking, so it will have a lot of physical, social, and psychological impact on the person. So if you see the respiratory disease burden, it is a major health burden on the world population. So almost it contributes to the this one. It is the leading cause of death. All the respiratory diseases contribute to the maximum death worldwide. And pneumonia, tuberculosis, lung cancer, and COPD, it almost contributes to 1/6 of the global death burden. And in today's generation, air pollution is responsible for various respiratory diseases such as nasal allergy, asthma, COPD, and lung cancer. So they are in the increasing trend. So with the increasing incidence of these diseases in the modern times, this has triggered the many scholars to do studies on yoga so that can help in handling and eliminating these problems. So coming to the role of yoga in respiratory illness. So previous studies, it has clearly shown that many people with respiratory diseases like COPD, TB, I'll be going through that. So they have found a better solution by adopting yoga along with the natural treatment. So what happens in yoga, as the mind is calm, the hyperreactivity that causes diseases such as bronchial asthma and nasal allergy is reduced. And the good practice of yoga helps in maintaining the proper health and profound effect on the lung functions of the individuals. So it also helps in prevention, control, and rehabilitation of many respiratory diseases. So coming to role of yoga in COPD patients. So WHO they predicted that COPD will become the third leading cause of death worldwide by 2030. But in fact, now it is the third leading cause of death. So you can imagine the pace at which the COPD is rising, and we follow gold guidelines for the management of COPD. So the management includes the reduction of symptom complications, exacerbations, improved exercise tolerance, improved health status, and reduced hospitalization of COPD patients. So I want to stress that all these things can be achieved by incorporating yoga along with the mainline COPD treatment. And also it has been shown that there will be increase in the diffusion capacity of COPD patients, and also it decreases the stress and anxiety and help in improving the quality of life of these patients. Coming to role of yoga in asthma patients. So you know that asthma is a common problem. So almost 300 million people are suffering from asthma globally, and 10% of asthma is contributed by India itself. So adopting yoga in asthma patient has shown that there is significant improvement in pulmonary function tests like peak expiratory flow rate, vital capacity, FQ1, and MV, that is volume ventilation. It has also shown that studies done on this yoga and asthma patients, there is decrease in ESR and absolute eosinophil count, which is raised in asthma patients. There is reduction in asthma attacks. There is a reduction in rescue medication. The use of medication has come down, and the quality of life has improved. And also, it has been shown that there is a relief of pain, stress, anxiety, and sleep disorders, both in patients as well as their caregivers. So these are some articles which have been done previously. The study done by Kaminsky et al. On COPD has shown that yoga, breathing exercise, and pranayama has significant effect on improving the pulmonary functions, quality of life, and help in add-on role of treatment in COPD patients. And another study done by Pallavi Yadav et al. So that is in the management of bronchial asthma. So what she has concluded that yoga and pranayama improves lung functions, quality of life, long-term efficacy of integrated approach of yoga therapy in the management of bronchial asthma. So various studies have been done on respiratory diseases like COPD, COVID-19, and lung cancer. So they have come to a conclusion that definitely yoga has a significant effect on quality of life, decreases the stress levels and anxiety levels. And also there is improvement in the lung functions. So coming to TB and yoga therapy, so some studies have shown that there are positive findings like the improvement in the daily basic living skills, maintenance of personal hygiene, self-care. There is improvement in the social interpersonal activities, communication and self-discipline in the yoga. And yoga therapy, if added as a daily discipline, can improve the overall functioning of TB patients. So this is a ongoing project. So one of our student has taken as a thesis. So what here we are doing is we have taken the TB patients and divided into two groups. So one group will just take the standard ATT treatment. The other group, along with the ATT, they will be given yoga training. So, and we are assessing on these parameters like pulmonary function tests, assessment of depression, and health related quality of. So this study, the pilot testing has been done, and we have got the good outcomes. And I think once this publication of study, we are going to publish in the good journal. So some yoga poses for TB patients which have been established are Vastarika, that is Velo's breath, Kapalabhati, Nadishodhana, forward and backward bending movements and stretching poses may also be good. And what exactly does yoga is that it increases the internal stamina and reduces the stress. So this is the Vastarika pranayama. So what this is a normal slow inspiration and expiration. This helps in complete emptying of the lungs and also taking full volume of air. So that will increase the total lung capacity of the patient. So this is helpful in COPD patients. In coming to Kapalabhati, so here we are the what yoga exactly does is that there will be contraction of the diaphragm and abdominal muscles. So that will help in completely emptying the lungs. So this there is a problem in COPD patients of incomplete emptying of the air. So if you perform these techniques, this will be definitely helpful in COPD patients. So that is what Kapalabhati will strengthen the diaphragm. So the diaphragm will be weakened in COPD patients. It rejuvenates the brain cells and cleanses the lungs, sinuses, and the respiratory system. So it adds some radiance to the face and calms and uplifts the mind. So there are a lot of benefits by adding yoga in COPD patients. And this is the Nadishodhana. This is nothing but an alternate nostril breathing. So this helps in clearing the respiratory system and sinuses. So pranayama for respiratory health. With pranayama breathing exercise in yoga, you can increase your intake of oxygen up to 5 times. So if the more oxygen enters the blood, heart, and other vital organs,
So this will enable the organs to work in a better and way, and this will bolster your health. So the various studies have shown that this pranayama technique can increase the oxygen intake up to 5 times. So with the rich supply of oxygen, it helps in removing toxins from the body, and also it reduces anxiety and stress, and also reduces the inflammation. With selected yoga poses, proper breathing can bring positive effects on respiratory health. So you will feel energetic after doing this breathing exercises. So it also can reverse the effects of aging and helps in this stretching and strengthening the chest muscles and this. So learning the art of proper breathing can provide the best benefits to your health. So some of the asanas which has been uh, advised to for various respiratory diseases, for all the respiratory diseases, or it's like cobra pose, that is nothing but a bhujangasana, and chakrasana, that is bridge pose, setu bandhasana, bridge pose, ardha matsyanasana, that is off lord of the fishes pose, sarvangasana, shoulder stand, ardha gati chakrasana, and ardha chakrasana. So these are all some asanas which are being beneficial for respiratory patients. This is nothing but a bhujangasana. So it will help in stretching the spine and abdominal muscles. And this is called chakrasana. So definitely it will help in strengthening the spine, abdominal muscles and the back. And Setu Bandhasana, it is a bridge pose. So this will strengthen your respiratory muscles, shoulder muscles, and the neck muscles. And the samanvaya. So what this is also will strengthen the neck muscles and the respiratory muscles and the diaphragm. This is the Ardha Matsyengasana. So benefits is it tones and strengthens the abs and oblique, external oblique muscles, and strengthens and energizes the spine, opens the shoulders, necks, and hips, increases the flexibility, especially in hips and spine, cleanses the internal organs, improves digestion and elimination of waste, and also it stimulates the liver, heart, lungs, kidneys, and spleen, and also it finally it releases the excess heat and toxins from organs and tissues. So this is just I want to highlight the things which can be done. The yoga people will be in a better position to explain all this. Just I am showing the pictures. So this is the Ardhakati Chakrasana. This is lateral bending, so it will increase the spine stamina and external oblique muscles. And this is another thing is called as the Ardha Chakrasana, which will strengthen your back, spine muscles. So the ultimate effect of yoga in the respiratory system is, so what exactly happens in yoga is the isometric contraction of the respiratory muscle, skeletal muscles. So which will improve the strength of inspiratory and expiratory muscles. So in Kapalabhati, there occurs the full use of diaphragm and abdominal muscles for breathing, and it helps in removal of secretions from the bronchial and also helps in clearing up of respiratory diseases. So in Nadi Shodhana technique, due to efficient use of abdominal and diaphragmatic muscles, the respiratory apparatus gets emptied and filled more completely and efficient. So that is what in during pranayama we are doing the slow and prolonged inspiration as well as expiration. This will stress the elastin and collagen fibers of the lung parenchyma, and the lungs are inflated near to the total lung capacity that helps in taking more oxygen from the air. So this is a major physiological stimulus for release of. Once the lungs are inflated to the total lung capacity, this will cause release of surfactant into the alveolar space, which increases the lung compliance. So in COPD patient, the lung compliance will be decreased. So definitely these are all going to help in COPD patients. So due to lung inflation, there occurs release of prostaglandins, so which will cause bronchodilation of the smooth muscles So this will be helpful in COPD and asthmatics. And once the stress and anxiety is reduced, so there will be drawing out of bronchoconstrictor effect seen in these type of cases. So to conclude, so there is a clear evidence to say that the asthma has a definitive role in, the yoga has a definitive role in respiratory diseases like asthma, COPD, TB, and other chronic respiratory diseases. So it is easy to learn and practice, and is almost free and extremely safe. Yoga is ideally suited for all people, and it can be added as a complementary modality in the management of all lower respiratory disorders. And the ultimate goal of yoga is to find perfection in life. Regular yoga practice improves various pulmonary function tests and is beneficial to improve the respiratory efficiency. The pranayama, which is a component of yoga, so this is one of the best remedies which help to tackle the respiratory illness caused by air pollution and other naturally respiratory illness. So with this, I want to tell that the yoga has to be incorporated in all the respiratory diseases, and definitely it has a role in this type of patients. Thank you. Any questions? Well, I have a question.
So what is your experience in using yoga therapy, integrated yoga model in anti-tuberculosis?
Yeah. So that is what I showed a thesis work which has been done by one of your student, which is you yourself being the guide and I am the co-guide. So we have done the pilot study, and we have seen that there is definitely some improvement in lung parameters and also the health related quality of life, and depression levels are coming down. So that is a pilot study. Once the study is complete, I think we'll have more results, and definitely will be a good study, and it will be published in some good journals. And COPD, asthma as well has been done in the past various studies. It is there is a clear evidence on these studies also. There is improvement of lung parameters and various things which I have mentioned now. So same thing will apply to tuberculosis.
Sir, what is your thought, hypothetical mechanism or underlying mechanism of yoga? Hypothetically, what do you feel or how it may be helping tuberculosis?
That is what, sir. In tuberculosis patient, what exactly happens is that there is a severe malnutrition. So there will be a lot of wasting of the respiratory muscles, abdominal muscles, and when there is if there is a lung distress, right, there is incomplete emptying of the secretions. So once these techniques, whatever I told you, all that Kapalabhati, pranayamas, and various, you will be in a better position. What are the things? So if that is adopted, so it will strengthen the respiratory muscles and spine muscles, and it helps in complete emptying of the secretions, and also it decreases the depression. Once the natural breathing comes, so the stress and anxiety levels will come down. So that way it will be helpful. Thank you.
Thank you, sir, for expounding the role of yoga in various respiratory disorders and for elucidating how important pranayama is in the respiratory health. I request Dr. Patil NJ to hand over a memento to Dr. Jagmohan SV. I request Dr. Malagi sir to join for handing over the memento to Dr. Jagmohan SV. Now, let me welcome the most committed and hardworking personality, Dr. Patil NJ, HOD and Associate Professor, Department of Integrative Medicine, Sri Devarajas Academy of Higher Education and Research, for his talk.
Good afternoon, everyone. This afternoon session actually supposed to be handled by Dr. Divya Prabha Madam, but unfortunately there is some technical issue. She is there in Nagpur in our Vice Chancellor Bangalore, but unfortunately connectivity is very poor. She may join us. So meantime, I thought my schedule was another day, but now today I'm doing it. Please take the mobile. Sorry for the disturbance. Yeah, why I have chosen back pain, even though the theme is wellness and humanity. Wellness depends on illness is different from wellness. The present system is basically more focused on illness. If you see, most of the time, what we are really focusing the physical part of the WHO, the mental, social, and the other component of health is missing at present. So we need to address that. And back pain is one of the most common. It is 90% of prevalence. If you see the epidemiology, maybe a prevalence of back pain, one or other time in our life, most of us will actually experience back pain. So I thought, today we also had a morning, disc herniation webinar, CME and workshop in the morning conducting by Department of Orthopedic. So I thought it will be a good thing to, even during COVID-19, a lot of people found the frontline warriors, and post-COVID also a lot of people facing a lot of challenges. So I thought an evidence-based approach, because most of the people feel yoga means doing some stretching. So what exactly, the current condition or evidence is available, it will be most of the time what I'm trying to more focusing on the mental aspect of management rather than the physical and other component. If you see any of the conservative management, it will be a NSID, maybe a painkillers, maybe a local or maybe a systematic. Apart from that, there will be some amount of surgery or maybe some local injection also maybe they're given. So morning also there was discussion that even traction also not having much of the effect. It is one of the Dr. Thomas from Manipal Hospital was sharing his thoughts. There is very minimal and there is no effect of the traction in back pain. What I'm trying to give an overview today. So in addition to the physical, I repeat, in addition to the physical component, which is similar to the physiotherapeutic exercises, what yoga can offer as a holistic approach. That's what I'm trying to address. So, as I said, this is the WHO definition of health. It is very much similar to the definition of health given by Sushruta. Sushruta is the father of surgery, not only in India, across the world. Yes, sir. So, if you see the definitions of the Sushruta or maybe a WHO, it is very much similar. The definition of WHO is very few, maybe a decade old or maybe a 1 century old. No, it is not more than that. If you see era of Sushruta is way long back. Okay, so this is very much similar to the WHO definition, which has been existing and it has been time tested for a longer time, which also focuses on the holistic component. That's what I'm trying to make you emphasize here. It is in addition to the physical component, prasanna atma indriya manaha. It is something very, very important. As I said, multifactorial. A person back pain working in maybe a construction work, the back pain person, the causative factors are different. Nurses having a back pain, the causative and risk factors are different. A person who is in a corporate sector, maybe MNC and IT companies, the back pain in them, causative factor and risk factors are also completely different. Even though all are back pain, but the nature of profession, the nature of causative factor, the nature of risk factor differs in each and every occupation. That's the reason if you try to look at the multifaceted management is very much important. The multidimensional approach is very, very important. I'm not focusing on the physical component, maybe overtraining, trauma. I'm not touching that part. Where yoga can play a very important role, which is the different from the physiotherapy aspect of the back pain. A lot of physiotherapy is given. It may be a TENS, it may be a local exercises, or maybe some other component will be giving on and off. There will be a tape also, bandage also. When I was there in Germany in 2010, that time also we are able to see that neuro rehabilitation, more than 14 kind of complementary and alternative medicine has been provided for the different conditions of pain management. If you see the pain, it's very interesting. Pain is more of subjective. It is very difficult to measure. We don't have an objective parameter till today to measure pain. Somebody, maybe a teacher with a stick, maybe it given a punishment for the 5 students. The amount of pain what students receive will be very different. Same amount of intensity or same pressure also heats. The amount of perception of pain. A lot of time, if somebody maybe are drenched in the rain, a lot of people may get affected by the cold and cough. Some people may not get affected. They are drenched in one instant when they are roaming around. Getting my point? So what I'm trying to make here, the pain is such a subjective. If you have a perception, acceptability of pain itself is the 50% of the problem will be solved. Okay, it's a pain. We will try to address. We will try to do best. But at the same time, if you psychologically start thinking, no, I have a pain, because it's a vicious cycle. Morning, our Honorable Vice Chancellor was expressing when he had a tough time during, when he has taken as an HOD, 3 people senior to him was there in the department as per the protocol of the university in the Manipal. He has to take over, but he has to handle the 3 more senior people in the department. He had a very tough time. So what he was trying to explain that he had a very bad neck pain, which is resulted him, he has to force to wear for a collar, neck collar for almost 4 to 6 months. So the lesion was there during that time MRI, but he started, one of the mentor helped him to come out of it. That's what he has expressed in the morning CMB. So what I'm trying to make a point here is, it's a psychological component of it. It is caused of the neck pain in this case. Stress reflect on the back. That's what we need to understand here. So in this case, how stress? So whenever there is a stress, there is a muscle spasm in the back. Stress reflects on the back muscle. There are 3 layers of muscles. One is the superficial muscles, intermediate, and the deep muscles. So whenever we give yoga, different yoga have a different posture, have a different level. It is not simply superficial, because we have even tried to make an attempt to do a surface EMG and also needle EMG to understand the electromyographs of the effect of the different asanas. So where also we are able to see yoga have an impact, yogasana have impacted the deeper muscles. So in addition to that, the physical component of this, what I'm trying to make you understand is the psychological component, where psychological component like anxiety, depression, stress, if you are not having the coping skills are very less, it very badly reflects. If you could have made also experience, whenever you are in a stressful situation for a longer time, your neck will become stiff, or you will have a neck pain. You could have experienced most of the people. That's what literature says. So it is very clear that psychological factors play a very important role in addition to the physical causative factor or maybe the risk factors. That's what I'm trying to address here. See, it is vice versa, somopsychic and psychosomatic. It's both. The pain in a long run, people who are suffering from a certain conditions for in a long run also have issues with a physical symptom. They don't have a psychological symptom. For example, over a period of time, the chronic pain induces the psychological disturbances. That's how it has become somopsychic. But what I'm now trying to make you understand is the typical MNC. It is people most of the time say ergonomics. If your proper height of the table or maybe a computer is not in a proper place, people end up with a low back pain or maybe the neck pain. It is not only so. There are recent, one of them, my friend in TCS is working as a yoga consultant, Dr. Panindra. He has been done a very wonderful study. What he has found is more than an ergonomic problem, it is the stress which is the because of the concentrate, no sleep, quality of sleep. These are all played a very important role. And also morning, Dr. Thomas was explaining from Manipur, they have done a survey of 2,500 nurses. It was very interesting finding what he has briefed in the morning. He was telling the more of the people have a quality of life was poor or maybe a disturbed sleep or psychological components plays a very important role, those who suffer from a low back pain. So most of the time, whenever we look at back pain, we are only trying to focus on the physical component of a back pain, but we are not able to address the psychological component of the back pain, the extent it needs to be emphasized or addressed. That's the reason I always say yoga is a holistic package. It addresses whatever benefit you are getting physically, you are able to do it. In addition to that, so in addition to that, we thought adding the mental component of it really helps. It may be asana, it may be a pranayama, it may be a mindfulness, it may be a bhajan, mantras. As I said, the power of bhajans, they can Google, we will get an idea. There is Dean Ornish, is a man who did a study on cardiovascular diseases, coronary artery blocks. I repeat, coronary artery blocks can be reversed with the kind of holistic program like diet and bhajans kind of thing. There is something resonance. Unless and until it is not a calcified lesion, I put on a record and it is available. Dr. Dean Ornish, he clearly mentions about that. So this is how a mind is such an important tool which really makes a lot of difference. So yoga is basically a mind management which addresses at the mind level. If you go through the whole book of Patanjali Yoga Sutra, you will not get a single posture about yogasanas. Stiram Sukham Asanam is the only one line spoke about the yogasanas. So we are doing the injustice by saying yoga helps in pain killing, yoga helps in improving the flexibility. We are doing the injustice. It's the tip of the iceberg impact of the yoga. It is beyond that. It can do a structural changes in the brain. It can bring a biochemical changes. It can bring a positive impact at the neurotransmitters. It can change the length of the telomere. That's an impact. But today, what we are talking about with few of the questionnaires, we are trying to say it is pursued stress scale. We are trying to say it's a pain. If we are trying to say it's a functional disability, we are trying to address this. Yoga is much beyond this. So major technological breakthroughs are not really helping us in addressing. This is what our Honorable Prime Minister of India on 20th June inaugurated one of the beautiful or maybe upcoming healthcare model. What he has inaugurated, what I came able to see. Till today, we are now struggling for the integration. Now, word is heading toward transdisciplinary. Transdisciplinary is very clearly mentioned here. You can able to see it's one of the most highest donations given by the co-founder of Mindtree, 425 crore. It will include science, engineering, and medicine. It is going to be most of the hospitals are clinical service oriented, where now our honorable Prime Minister has been now focused. And this, which is the hospital which is focused on the integration, are they heading towards transdisciplinary? Clear? So, if you see in back pain, we are only focusing again on the back and muscle stretching and giving painkiller and blocking. the kind of side effect of NSAID is very huge. Maybe an orthopedician prescribes medicine for 4 days, but the patient takes most of the time, months together, whenever on and off an SOS. Getting my point? So it is causing a damage. Everybody knows obesity is one of the reasons for back pain. Okay, and exercise, sedentary lifestyle is a problem. Stress is another problem. For everything, you can able to link to the mind. What is good, what is bad, we know it, but still we are not able to have control over the tongue, which we end up with a problem. So it is very, very important to control the mind. If you control the mind, you can control the tongue. Tongue is not a culprit, the mind is a culprit here. Sedentary lifestyle, we know everything. What is good, we are getting up early in the morning and doing exercise is good, but we are not doing it. So stress is something uncontrolled, non-standing is a problem where we are able to address this. So stress is there for everyone. It may be a school-going children's. Also, it is maybe a youngsters. It may be a married couples, and also at the old age after retirement, everybody have a stress. And this is a beautiful animated picture by Dr. Nagaratna and Dr. Nagendra, which says based on the Panchakoshas, that is taken from the Taittiriya Upanishad. See, one concept from Taittiriya Upanishad, one university standing with 49 country association doing collaborative studies with Harvard and MD Anderson's. The power of Upanishad we don't understand. We are really more worried about the Western knowledge. I'm not against Western knowledge, but try to understand the concept. One concept from Taittiriya Upanishad can make one university with 49 country association with a involving Harvard. They have conducted 3. That's the power of our Upanishads. We are trying to understand that the modern parameter with the reduction parameter proven in a different way. So these are the few evidences. Probably, I will just ask the people. Otherwise, I will share these slides another time. Ashwin, they are ready. She is ready. So regarding evidences, probably I will again come back and share with you what are the evidences. So what NIH says and what are the evidences. Now, because Madam is ready, I think.
Thank you, sir, for explaining how yoga is useful as a therapy in low back pain, and for making us clear that how lifestyle changes can prevent stress, which can lead to low back pain. Because of the technical issues, we have rescheduled Dr. Divya Prabha's talk. Now, I welcome Dr. Divya Prabha, co-founder, Yoga Mission, United Kingdom and International Chandramouli Charitable Trust, Varanasi, India, to present her talk. Over to you, ma'am.
Thank you so much, and sincere apologies for the technical issues that I was facing. I'll start with Pratana to our gurus. Guru Brahma, Guru Vishnu, Guru Devo Maheshwara, Guru Sakshat Param. Thank you so much to the organizers of this wonderful conference on yoga, and especially to Dr. Nitin Patelji, a great speaker that we just had the pleasure to listen to just now. I've prepared a presentation about yoga, the science of stable wisdom. These days, there's a lot of research in the name of science happening in the field of yoga. But sometimes we forget that yoga is not a subject that has just come here in the last 50 years, 100 years, but it's something that is thousands and thousands of years old, which is as useful now today as it was thousands of years ago. And in fact, even seems as though it is brand new and fresh today. This knowledge never gets tired. And what I'd like to do is to bring the Shastras, the knowledge of the Vedas, the Upanishads, into our practical use, showing how they have given this knowledge about the psychology, about the knowledge of yoga and the consciousness, and how through the practices of yoga, we can know our real selves in a scientific way. So I prepared a presentation for you, which I hope that you enjoy. And I'd like to start with, start with the source of yoga. The source of yoga comes from the very beginning of it in existence. It comes from a time where there were rishis and munis who realized this knowledge from themselves, a time that there was no division of religions and dharma, no divisions of country, philosophies, caste, or gender, or even color. It comes from a time when we realized that our Father was that consciousness, that Paramatma, and that all beings were our brothers and sisters in a family simply known as humanity. And this knowledge has been given to us again and again through the Vedas, through Upanishads, through Purana, through Mahabharata, through Ramayana, through Yoga Darshanam, through Gita. But no matter which Shastra we access the knowledge through, we always find that it reaches up at one truth of yoga itself. And so whichever path we take, it doesn't matter. And in the beginning of Patanjali Yoga, there's a very interesting line, Atta Yog Anushasanam. Now this means much more than just here now, I'm going to tell you about the discipline of yoga. That Anu in front of Anushasanam is referring to a knowledge, a discipline that has come from before. So Patanjali himself is making it very clear that he's not the first one to tell us about the knowledge of yoga, but in fact, this has come from ancient rishis again and again, and you can search for these names in the Mahabharata, like Bharadwaja and so many more. So the very first we're told about in Mahabharata is Hiranyagarbha. And we find the description of Hiranyagarbha in the Rig Veda. Hiranyagarbha samavartatagre putasya jata patire kasita sadadara pritvam kyamutamemam kasmai devaya havisha videma. So here we're being told that Hiranyagarbha, that divine existence, that divine manifestation, that goldenness, is the Swami, the master of the land, the skies, of the Akash, the space, and everything that exists beneath that. And so here we're told about the very first teacher of yoga. And the Upanishads give us a little bit of information about what this manifestation of life is all about. It says that life is like a stream flowing between the two banks of life and death. And it describes further, Yatha nadyasyandamana sumudrestam kachanti namarupe vihaya tata vidwanam rupat vimukta parat param purusham upaiti divyam. It tells us that we ultimately become absorbed in our source of consciousness. That is like the way streams and rivers become absorbed in the ocean, giving up their names and their forms. In the same way, but when we realize that unity with that consciousness, we leave behind our name, our individual name, and our individual form. So this is what the aim of life is, as described in Shastras like Karma, Artha, Kama, Mokshanam, Purush, Artha, Chatushtayam. And I want to show you how this is very scientific knowledge. We talk about moksha, we're talking about moha se mukt, freedom from delusion. And this is what yoga, through practices focused on the mind, as Guruji himself, Dr. Nitin Patelji, was also talking about the use of the mind in the practices of yoga. This is the real field of activity in yoga. And in Sankhya yoga, Sankhya philosophy, Lord Kapila Muni told us what is the purpose of life. And he said, Atatrivid dukkatyante nivrityanta purushata, meaning that the purpose of life is to become free of the three kinds of pain. If you think about it very carefully, everything we do, every human does, is with the aim of peace and happiness, whether it be choosing what food you're going to eat, whether it be what work you're going to do. We're always choosing activities where we aim to attain happiness. The thing is, we're always choosing temporary means, temporary sadhans for attaining that peace and happiness. And yoga is about attaining that permanent peace and happiness. And as Kapila said, that these three kinds of pain are adiboltic, so involved with our individual existence, adidevik, that collective existence, and adhyatmik dukh. And a lot of people don't realize that the adhyatmik dukh, it's very, very simple. It's simply the separation of your individuality from your universal existence. So yoga is the means to know yourself. And how do we do that? The Gita tells us about Sankhya Nishta and Yoga Nishta, but really, ultimately, there's no difference between the two of them, because both of them result in making our organs and our senses effortless and surrendering into that consciousness, just in different ways. And Samkhya Yogo Pritak Palha Pravartanti na Pandita. The person who understands Sankhya and Yoga as two separate paths and practices and schools of knowledge, Sri Krishna himself said, doesn't understand them really and is not a pandit. So let's start with the definitions of yoga itself. In Panini's Dhatu Path, which was given to us 5,000 years ago, the reason I'm stressing on all of these and dates and ancient texts is to really give you that sense of heritage, ancient knowledge, and the fact that this is not something new. In these times, yoga may seem to be like something new, but ultimately it's very old, ancient, continuous knowledge. So in the Panini Dhatu Path, they say, Yujang Samado, Yujir Yoge, meaning the two verbs, yuj, making the word yoga, have two meanings. One, samadhi, samadhi, samabuddhi, stable intellect, stable wisdom, balance. And yujir yoga, joining to what? To your real self, turning from the outside sense-driven, nature-driven, temporary means towards turning inside to that which is permanent. And Patanjali says, yoga's chitta vritti nirodha, telling us that yoga is the means to bring under control our chitta and our vrittis. So there are many different practices, and these days it's become very fashionable to say, I am a Kriya yoga teacher, I'm an Astanga yoga teacher, or I'm a Hatha yoga teacher, or Vinyasa, or whatever it may be. But what I want you to understand that scientifically, when we're talking about yoga, it ends in one thing, samadhi, stable intellect, and in union. And each of these different paths, so-called separate paths, actually all converge together and just different ways of expressing the same thing. Kriya Yoga, Tapa Swadhyaya Eshwara Pranidhanani, Kriya Yoga. Austerity, tapa, meaning not just physical austerity, but also controlling of the mind and controlling of our words and our speech. Swadhyaya, studying ourselves. I remind you that the meaning of health, swastha, in Hindi and Sanskrit, actually comes from swatishtati iti swastha, meaning to be stable within ourselves, is the definition of health itself. And so that study of ourselves is part and parcel of Kriya Yoga. And that surrendering to that Ishvara, to that consciousness, allowing us to be guided by the universal consciousness, as opposed to our individually driven ego and mind. And then Ashtanga Yoga, as all you know, Yama, Niyam, Asana, Pranayama, Pratyahara, Dharan, Dhyan, Samadhi, Ashtanga, Vani. In this, I want to point out the definition of asana, Stirsukam Asanam. When we say Sharir in it and Stirsukam Asanam, we're not just talking about our physical body, but we're also talking about our sukshma, our mental body as well. So it's also talking about mental stability as well as being the foundation of an asana. And Hatha Yoga probably is one of the definitions that is possibly less understood. But through the study of Sanskrit, we can understand the word of Hatha, which comes from a combination of hum and tam. Now we know that the hum and tam must have equal emphasis in this compound word, the samas, because of the construction of the word Hatha, which is technically called samahara dwanda for those of you who are linguistic or grammar specialists. So it means that hum and tam are going to be equal. That means the right nostril and the left nostril, the prana and the apan, the sun and the moon, the rajaguna, tamaguna, and the hot and the cold. And so when we get the union, when we get the balance of these two, the hatha, this is when we go into meditation. We're not in a position to act externally because we're no longer involved with the rajaguna and the tamaguna because they have become balanced. And so what is it that is leading to the turmoil that we face in life? What is yoga providing a scientific solution to? So Patanjali says, Vriteha panchateha klishta klishtaha, meaning that the vrittis, the modifications of the mind, are 5 kinds, which are either painful, klishta, or aklishta, meaning not painful, an absence of pain. And they are praman, vipareya, vikalpa, nidra, smrtiyaha. Now, you might be knowing that in the fields of psychology, there are a lot of psychological techniques which rely on bringing past memories into the present, searching for past memories, searching for the source of those memories. But according to Patanjali, by bringing those memories into our present, we're simply bringing the pain or the absence of pain associated with that memory. And so according to the philosophy of yoga, the science of yoga, we want to go beyond the realms of the vrittis, beyond the limitations of nature. And praman is, you know, that correct evaluation, proof, vipareya, wrong knowledge, opposite knowledge, misconceptions, and vikalpa, that speculation, that internal experience of is it or isn't, And that takes us to the Vedic definition of Ashta Chakra Naudwara Devanam Purayotya. This is from Atara Veda, and it tells us that we consist of 8 chakras, that we consist of 9 gates, 2 eyes, 2 ears, 2 nostrils, 1 mouth, and 2 lower gates. And then through the practices of yoga, we aim to close these 9 gates, open the 11th gate in the Brahma Chakra, cross from the Mula Chakra, one by one, Swadhisthana, Manipur, Anahat, Vishuddha, Lalana. Lalana Chakra is one that is less talked about. And interestingly, this is where Kejari Mudra, for those of you who are familiar with that terminology, is active at the Lalana Chakra. And that is how we, through the practices of yoga, stop the breath, stopping the mind, which I'll go on into more detail in the pranayama section, then crossing Agya Chakra and reaching the Brahma Chakra. And he says that we are the dwelling place of the divine beings, and its name is Ayodhya. I don't know how many of you have ever wondered what the word Ayodhya means. Ayodhya means Nayodhya, Ayodhya, the place where there's no battles, where we experience that inner union. Because when we're disconnected from our real selves, that is where we are unsure about what to do, what not to do. When we are disconnected from ourselves, that is where we experience that mental turmoil, that the experience of the vrittis that cause us this pain and suffering. So the Vedas is telling us that our real existence is this dwelling place of divine beings, that we are a place called Ayodhya where there's no battle, that we're united within ourselves, and that the journey of life is to cross the 8 chakras. And the Bhagavad Gita is also a very practical and scientific shastra. In the Bhagavad Gita, in the 2nd chapter, there are 2 shlokas that clearly tell us about how we fall down into suffering. It says, Dhyayato vishayan pumsaha sangasteju bhajayate, sangat sanjayate kama, kamat krodho bhajayate, krodhat bhavati sammoha, sammohat smriti vibhramaha, smriti vibhramashada buttina sho buttina shat pranashyati. It's telling us that there are 7 stages of downfall. First starts by concentrating on the external objects. And we start to become engaged with those objects through sangha. And then we start to desire those objects, kama. And from that desire, whether fulfilled or unfulfilled, comes anger, krodha, from which comes delusion, which leads to forgetting who we are, what we are, forgetting our real selves, leads to the destruction of our intellect, which leads to the complete destruction of ourselves. And so through the practices of yoga, which tell us about having a focus point, for example, with mantra, having our aim clear, yet performing our action through our manifestation. When I talk about action, about our kriyas, you'll be interested to know what the real definition of karma is. In Panini's Ashtadhyayi Sutras, the Grammar Sutras, he gives us a beautiful description of what karma is. He says, Kartuhu ipsitamam karma. The most desired actions of the doer is called karma. So we can change from karma to absence of karma simply by redirecting redirecting our desires by keeping our desires under control. You can't suppress desires. You can only redirect yourself, which is what Ashtanga Yoga is teaching us. So keeping our focus on that aim of life, that Dharma Artha Kama Mokshanam,
Sorry, because of technical issues, ma'am has disconnected from the webinar, from the conference. She'll rejoin us shortly. We are going to start the panel discussion within 2-3 minutes. Please be with us.
Good afternoon. Is it audible to you all? Dr. Patil?
Yes, yes.
Okay.
Namaste, sir.
Namaskara, sir. Namaskara.
Sir, I will start now because some technical issue with Madam Divya Prabha. Madam is in Nagpur, I think, for one of the university. There is some technical issue for her. So even I'm not able to reach her through the call. So we will start the panel discussion, sir, as discussed. Sir, you are not audible, sir.
Unmute madam.
Okay. Yes, sir.
Hope it is audible, sir. To you now?
Yes, sir, you are audible, sir.
Okay, okay, sir. Dr. Patil, shall we start, sir?
Sir, just 1 minute, sir.
Okay.
Thank you, ma'am. We enjoyed listening to your enthusiastic talk. We connected deeply to the content you talked about. Thank you very much. Now, let's start panel discussion. Let me introduce our galaxy of speakers who have joined us for the panel discussion today. Dr. Bannappa U. He is a scientist at ICMR, NITM, Belgavi. He is an expertise in the field of research. He is going to be the moderator today's panel discussion. I welcome you, sir.
Thank you, madam. Thank you.
Now, I welcome the panelist members. Dr. Navisha A., Professor and Head, Department of General Medicine, Sri Devaraj Arts Medical College, Kolar. He is an expertise in the field of modern medicine. I welcome you, sir. Now, I welcome Dr. Patil NJ, Associate Professor and Head, Department of Integrative Medicine, Sri Devaraj Arts Academy of Higher Education and Research. He is an expertise in the field of integrative medicine. I welcome you, sir. Dr. Hemant Bhargav, Assistant Professor in Yoga, Department of Integrative Medicine, NIMHANS, Bangalore. I welcome you, sir.
Thank you. Namaste.
Dr. Hemant Bhargav, sir, is an expertise in the field of conventional medicine and integrative medicine. Thank you for being with us, sir. I welcome Dr. Balaram Pradhan, Associate Professor, Division of Yoga and Physical Sciences, S. Vyasa, Bengaluru. He is an expertise in the field of evidence-based yoga research. I welcome you, sir. Dr. Harsha Hegde, Scientist E, ICMR, NITM, Belgavi, India. He is an expertise in the field of research. I welcome you, sir.
Thank you so much.
Dr. Manish Barwalia, Scientist E, ICMR, NITM, Belgavi, India. He is an expertise in the field of research. I welcome you, sir.
Thank
Really?
I welcome Dr. Suresh TN, Professor, Department of Pathology, Sri Devaraj Arts Medical College. He is an expertise in the field of medical education and modern medicine. Dr. Sheila Essa, because of some medical emergency, she couldn't join us. Now let us start the panel discussion. Over to you, sir.
Thank you, madam. Thank you for the.
Sir, you can start the session, sir.
Right, sir. Thank you. I hope it is audible to you all, sir. Yes. Okay. So once again, I thank this organizing team for this arranging this an international webinar and inviting these wonderful speakers across the globe. Those who people have contributed a lot. I was just listening to the Dr. H. Lucy. She was gave a wonderful lecture on this yoga, and we were it was like enlightening. In fact, we are very much thankful to Madam and yeah, thank you. And there are several other speakers also who have enlightened us. I have witnessed some of them. So with this, I again welcome all these panel members also. We have a galaxy of the experts from the different fields, starting from this traditional medicine to the modern medicine. And the concept of this today's the panel discussion is on integrative medicine. And it will revolve around the first of all a need and the definition of the integrative medicines and the challenges, the opportunities, and the current scenario and the future way forward or the future direction of this integrative medicine. So as I said, the lot of questions arises to the research mind that now what exactly the definition of integrative medicine it is. So in the light of this establishment of an WHO Center for Traditional Medicine in India, and also across the globe, there are several agencies, including the NIH, have started the Centers on Traditional Medicine Research and Integrative Medicine. The concept of the integrative medicine departments have started in several universities across the globe. So that all will initiate, will kindle the interest and the need of this the integrative medicine, the concept, and the ongoing discussions at various levels across the globe will also emphasizes the need for this integrative medicine approach. It seems that now it is the right time. It is a timely topic to discuss what we mean by integrative medicine, what are the challenges which we are facing, and what are the opportunities which we have, and how to go about. So when we come across these, the definitions are the word, the integrative healthcare, integrative medicine. So the people's like, the researchers especially, they have a specific questions about what these different terminologies mean and how these different terminologies are different. So these are the part of an active public dialogue about this healthcare, and at the recurrent, it is a recurrent concern in that conversation is the need for a greater patient-centeredness and patient engagement. So the need what we feel is that the chronic diseases especially are the today's most important health challenges, and which generally develop slowly and are subclinical during the most of their evolution. The current healthcare system focuses primarily on the treatment or a management of an established clinical disease. But with the availability of these newer technologies and tools, which allows us to detect the diseases in an earlier stage, and the availability of these modern predictive technologies to determine the baseline risk will actually enable us to focus on the health enhancement or the what is called the illness to the wellness by adopting the preventive approaches, reducing the risk of the people who are not yet having the full-fledged disease symptomology. So this not only helps in diagnosing and the preventing, it will also help in optimizing the treatment for those which are already ill through this the precise care. So it is clearly evident now that the most diseases risk is heavily dependent on what the individual does. Like it includes the achara, vichara, vyayama and all. So that means that the nutritions which we consume, substances which we are exposing ourselves, both these environmental pollutants as well as our dietary intake and other aspects, and also the physical activity, or avoiding that physical activities also, and the stress, psychosocial environment. These are all are the factors which are challenging and needs to be tackled. So in that sense, incorporation of these the traditional methods or the yoga and other practices may come into the picture. So we were listening to, as I said, the previous lecture by Dr. H. Lucy, who lucidly elaborated on the importance of yoga in maintaining the health at the first place before we become ill. So with this, I invite all the panelists for the discussion, and I'll begin with some of these frequent questions which are enlisted by our the team. I hope that now let us begin with what is the integrative medicine itself is. So I'll pose this question to all the panelists. So from the modern medicine field, Dr. Ravisha, Dr. Sheila, if she are there, please comment on that, please. What is your opinion on this, or what is the integrative medicine concept is, sir?
Good morning, everyone. And I thank organizers for giving me this opportunity to participate in panel discussion. So, to coming to the topic of integrative medicine. Integrative medicine is integrating different aspects of medicine. Like you have Ayurveda, you have Ayush, you have Unani, you have Siddha, you have allopathy, lots of other things. So all those things has to be integrated for the well-being of a person. So it is to improve the health of a person. So we are going to integrate different aspects of all the aspects of the medical sciences. So medical sciences need not be always allopathy. It can be Unani, it can be yoga, it can be Siddha, it can be homeopathy. So there are lots of things which have been practiced all over the world. So for the well-being of the person, for the well-being of a patient, so we are going to integrate and see where we have a best solution for any problem. So that's what we are going to do. If allopathy has got a best problem, it's okay. So go to the allopathy. If Unani got Unani, Ayurveda got Ayurveda. So after all, we are working for a well-being of a person. So that's what it is. So integration means we have to integrate all the aspects, including your nutrition aspects, including your exercise aspect. So all those things. So whichever teaches and whichever helps for the well-being of a person. So we are going to take everything from every science and integrate. So that's what integrative medicine means, as per my knowledge.
Yes, sir. Thank you very much. And I will take these questions to the other panelists also. Before that, I'll have. Yes, sir.
Banappa sir, actually, Dr. T.N. Suresh sir has joined.
Okay, sir. Okay. So,
Dr. T.N. Suresh sir is a professor of pathology and also a medical education expert. He has joined us. He had a meeting. Now he has joined, Dr. T.N. Suresh.
Welcome, sir. Welcome.
Related integrative medicine and medical education.
Yes.
Sir, I welcome you, sir. Sir, go ahead, sir. Banappa sir, please go ahead. Sorry for disturbance.
So, in continuation to the previous question, sir, and it will be extending it to the other panelists also when they comment on it. So, with in the backdrop of this, the Yoga Day, which we have celebrated yesterday, and the main the theme of this today's discussion on that aspect is that how yoga can help in this medicine. So that's I invite the comment from Dr. Ravisha.
Sir, actually, yoga, there are a lot of things which we have to learn from yoga and how it is going to help in controlling or aligning the diseases or towards the good health of a person. So to improving the health.
Yes.
So like we have meditation. So for example, so meditation definitely reduces your stress. So indirectly you are reducing your blood pressure. So and also it takes care of diabetes also if patient is diabetic. And it is for the usually the mental health. There are lots of problems where they'll go for depression and they'll have anxiety, they'll have manic disorders. So these things will be definitely helped by the people who usually do yoga and meditation. And if you do a pranayama, it is very good exercise for the lungs. So especially when we had a COVID recently, So
Yes.
we advise everyone to go for pranayama. So pranayama is very good exercise for the lungs, and it can take care of the immunity of the lungs, and it can improve the defense system of the lungs. So like that, and you have few exercises, especially in yogasana, where it can increase the insulin secretions. So there are few asanas which can increase the insulin secretion in the body. So that can definitely, if not totally control, at least it will improve the diabetic control of those patients actually. So, and we are doing Shirshasanas, okay, for example. So that will improve your concentration. So that sort of things. There are many asanas like that, where you have a lot of things which can be contributed to many elements which are chronic diseases most of the times. So in that way, it may help, yogasanas may help to improve the health status and also to decrease the sufferings of a person. So that's
Yes,
what
sir.
it is, sir.
Yes, sir.
Thank you.
Thank you very much. You have answered the several other questions also which are enlisted, like the palliative care also you have covered, and also the about the aspect of pranayama also, how it will help, the yoga will help, and how it can be integrated. So I'll take the question, further to the Dr. Hemant Bhargav for his comments, sir. Both the integrative medicine and its comment on integration.
Thank you very much, sir, for this opportunity, and my congratulations, to SDUAHER for organizing such wonderful conference. Sir, can I share my slides, sir?
Yes, sir.
Okay.
Team, organizing team, can you please?
Yes, sir.
Are my slides visible to you?
Yes, sir. Yes, sir.
Okay.
Yes, it is visible.
The American Board of Integrative Medicine has provided this operational definition. So it says that it is the practice, of medicine that reaffirms, the importance of relationship between practitioner and patient and focuses on the whole person. And therefore, this particular practice makes use of all appropriate therapeutic approaches, healthcare professionals and disciplines to achieve one objective, and that objective is of optimal health and healing for the patient. On the same line, sir, if you see the National Education Policy 2020, it is a very recent policy that says that, considering the demand that from the patient, the healthcare approaches is that the patient always approaches doctors of multiple disciplines, and therefore it is recommended that people from the modern medicine have a knowledge of traditional approaches and vice versa. So that would help actually. So this is a recommendation that has come. Now this is a particular figure that provides two approaches of integration that has been happening. Recently we have actually our one manuscript has been accepted for publication, where we actually describe different models of integrative medicine that are followed all over the globe. So one model that is very common in the Asian countries is the model of integration, which is followed by China, where the traditional systems are integrated from the beginning into the medical education and practice. Whereas the model that is followed in India and South Korea, it is a model where it is a parallel model, where the traditional systems, education and practice, and the modern medicine education and practice go parallel to each other, and they rarely intersect and interact with each other. So if you look at the history, traditional Chinese medicine is something which is recognized all over the globe. Even in US, there are traditional Chinese medicine practitioners in their integrative medicine department. So integrative medicine has been there over the last 2-3 decades in US, Germany, Australia. But their model of integration uses acupuncture, they use chiropractitioners, they use traditional Chinese medicine. But there we do not see the place of indigenous Indian systems of medicine in their integrative medicine definition. So why that is so? One thing that in the we found out is that in 1950s, China was in the similar position is there now, and what they started at that time was that they started training their modern medicine physicians into traditional Chinese medicine, and they continuously for this organize one conference after another, and chose specialists of gastroenterology, neurology, various specialists, and gave them that area of traditional Chinese medicine and allowed them to interact with the traditional Chinese medicine practitioners, be with them, learn that medicine. And when that continued and the interaction happened, some medicine can contribute into the modern way came up. So their research is much ahead, and we have to catch up now. And because of that, they could generate sufficient evidence base, and because recognition of their system of medicine all over the globe. Now, the model that is followed in India is patient comes, he goes to a biomedicine professional, speaks to him, then he goes to a Ayurveda professional. Now, the approach of mere co-location, various aims where there is a Ayush division, but that Ayush division does not interact with the medicine professor or the orthopedician or the endocrinologist of modern medicine within their institute. So patient separately seeks Ayush services, they are told, okay, you have to go to that side of the road, whereas those who want modern medicine have to come to them. And the doctor endocrinologist gives advices, and then when the patient asks this doctor whether I should take yoga, whether I should take Ayurveda, has no idea. So doctor says, I don't know. And sometimes, the advices that they receive from the two doctors are contradictory, and ultimately the patient gets confused. Similarly, when they go to the Ayush doctors, because of misleading conceptions, some doctors immediately tell them to stop medications, and without any rational and scientific rationale to it. This has happened because the doctors at different levels are not interacting with each other, and ultimately patient has multiple advices and doesn't know whom to follow. So this approach is called as cafeteria approach, where there is no mutual interaction and patient selects and goes at his will. There is this model that we have started now at Nimhans, where I am a yoga faculty, I am an MBBS person with MD PhD in yoga. In our department, we have a psychiatrist also, we have a neurologist also. Now all three of us, modern medicine people, sit together, and when the patient comes, all of us interact with each other and find out the best possible personalized way of treatment. And the SRs and JRs who are getting trained in our department is that we are able to develop an integrated physician who has an idea of all the different systems of medicine, and then he interacts with the patient. So this is my whole concept and idea about integrative medicine, sir. Thank you, sir. Thank you.
Thank you, sir. Thank you for the very clear-cut information regarding the integrative approach. In contrast to this cafeteria approach, which is going on across the country now, confusing the patient that which system he has to adopt. Instead of that, a panel of physicians who can guide the patient in a best possible manner for the best care in a patient-centered approach. That's the great initiative. Thank you for that information, sir.
Sir, Vanappa sir, Suresh sir.
Yeah,
Will.
Yeah, sir. I'll request that Suresh sir to give his comment on this integrative approach and the contribution that yoga can do in this.
So good afternoon all.
Yes, sir.
Am I audible?
Yes, sir.
Yeah, I fully agree with Dr. Hemant has nicely explained. So how usually how the patient will approach any type of treatment. So he has beautifully explained what you true meaning of integration. So in the patient care. So I fully agree with you. I don't have much to add. So I'll add when it comes to the education and other related issues. Regarding patient care, he fully explained what should be the integrative approach for any long-standing diseases.
You can add about how to go about and creating this feasibility through the education, sir.
Yeah, so I just to share my own experiences and also with my colleagues' experience when it comes to the medical education. Actually, there are a lot of gaps in the education systems which we have to address, because what Dr. Hemant has explained is the patient treatment. Because a lot of demand has come from the society to integrate. It has actually not happened overnight, because now patients are demanding. So, sir, your medicine is not working, what I should do? as a nth moment, the doctors are now prescribing the alternative medicine. Why it is happening? If you question back and ask ourselves why this is happening, there are a lot of gaps in our education system itself. As a medical student, I graduated almost 35 years back. That time there is nothing called yoga or alternative medicine which was taught to us. So we never know what are the benefits. We only know from our ancestors, from our own family background, what are the benefits, but we never taught in a traditional teaching or curriculum how to go through this alternative medicine, how to prescribe them. So now there is a lot of efforts has been made only in the 21st century. Before that, hardly it was practiced by any officially by the any medical professions. So only in the, I remember in 2009, so by the JIPMER Institute, where they first conducted the workshop on integration of yoga in medical curriculum. There's a lot of hue and cry. So why they are bringing other medicine into the MBBS curriculum? No. There was a lot of debate happened at that time. But a lot of things have changed from 2015 onwards, where the NMC, that time we used to call Medical Council of India, now it is called NMC. They started looking at it in a holistic view. So unless we introduce these alternative medicines or integrative medicine into the MBBS curriculum, it cannot hold a long standing outcome. So in that context, in 2019, so the National Medical Council has made it very clear. So the MBBS students should be exposed to this alternative medicine, and they are first introduced in the foundation course. So I should congratulate Nitin and his team, which they took a lot of classes for the first MBBS. There also it is most of the time it's like a sensitization. It is not actually not much of practicals. So only theory was being taught to them. But now the Ayush department with the NMC, they all came together and said that it is not sensitization, it should be more integration. Now, if you look at the MBBS curriculum, so they are all exposed year-wise. Every year they will be exposed. And during internship also, now they are exposed to alternative medicine. Just for information, I can tell you 1 week mandatory internship all medical students should undergo. That's a big step. So unless our MBBS graduates are exposed in a systemic manner, they will not understand the importance. They always kept this as a watershed area. So I'm sure now by the society demand also, and by exposing our student to this holistic approach, so we can go a long way. So already the steps has taken, sir. I don't think
yes,
in the next few years, definitely we all has to hold hand each other. We cannot sit in our room, comfortable room, and thought. NIMANS, I know that I worked in NIMANS also, so they are doing a very good job. I'm aware of the JIPMER who are already doing it a lot of work. So Dr. Sethu, Dr. Ananthakrishnan sir, and things like that. I think to name a few, I think there are a lot more departments which are included. So there is always a promising outcome by integration of yoga at the curriculum, not only yoga, other branch of integrative medicine. That's my view, sir.
Yes, sir. As you rightly mentioned, sir, at the initial stages of their education itself, if they get exposed to these, I say that it is the other systems of medicine instead of an alternative systems. The NMC has also recognized, and now these medical graduates are going to be exposed to these other systems of medicine. And already NIMANS, I am very happy to learn that NIMANS and JIPMER, they have already incorporated such an aspect into their training programs to the senior residents and junior residents. It's really going to help for the integration of these in the perspective of that patient care, sir, complete patient care. Thank you for your input, sir. And I take these questions to my colleagues, Dr. Harsha Agade, for his comments, sir.
Yeah, thank you, sir. Just to add on to Dr. Hemant and Dr. Suresh, sir, it's a very good initiative that now even the medical fraternity as well as the fraternity from the other health sciences, including Ayurveda or Unani, they're understanding the importance of coming together. That is what the requirement from the public, and it's a very good initiative. But it's a long way to go because I think the evidence-based medicine is the first step. Like, for example, if we want to take it to the higher levels, the first question is what kind of evidences we have about our traditional systems of medicine. One is clinical integration. The meantime, we have to understand the science behind it. I think that will take us to a long way, but it's a very good initiative. I'll really appreciate. And the such kind of initiatives are there in many of the kind of places in isolation. For example, long back in Medanta Medicity in New Delhi also, they have started this kind of approaches where they are giving all kinds of other alternative systems as an integration part, like post-operative care and all those rehabilitation programs. So these kind of efforts are being made in isolation. But as Suresh sir said, as it is now being integrated in the education system itself, it's a very good step. And I hope that in a short period, we can come up with a very good results where we can, as he rightly said, we can get all kinds of medical facilities as per our need and which is beneficial to us, which patient cannot be understanding like what kind of medication he has to have for his ailment, but which will be decided by panel of doctors from various backgrounds. That will be really beneficial. That's from my side. Thank you so much.
Thank you very much, sir, for highlighting the need of research, even in the integration also. So that's the message he has given. I invite the comment from my colleague, Dr. Manish Parvalia, especially on the safety aspect. If it is,
I think almost good afternoon, everyone. I am Dr. Manish Parvalia, working with ICMR NITM. I think almost all panelists have covered a right definition of this integrative medicine. But my view related to integrated health and medicine is that integration should happen at two levels. One is therapy and another is healthcare system. If we see one example of integrated medicine or at the therapy level, the recently one formulation has been approved, that is Rizorin, combination of isoniazid, rifampicin and one traditional molecule biopiperine, which has proven its adding of this biopiperine into this rifampicin and isoniazid has proven the reduction in side effect and reduction in dose of this medicine. So we can have another aspect of integrated medicine like that. In modern medicines also, we have certain conditions where we are still finding some solutions. So in that situation, we can combine the this system, modern medicine and alternative system, and another aspects of integrated medicine has been already covered by all the experts. So I am not going into the detail of this. Regarding this traditional Chinese medicine, Dr. Hemant Bhargav talked about. Sir, as I am pharmacologist, I mainly look into the safety of particular, even any type of system. Traditional Chinese medicines, they have very well systems, as you mentioned. They are looking into the quality also. They have stringent regulations. They are having good manufacturing practices also. Even though they most of the formulations are also there, which are given intravenously. And recently, I analyzed one safety data and found that there are few Chinese medicines also which even lead to anaphylactic reactions and even very dangerous toxic epidermal necrolysis. So simultaneously, when we are talking about integration, we have to focus on safety of all these therapies also. So that is my view on integrated medicine. Any further comments are there? It's invited.
Thank you, Dr. Manish. With one example, a very good example, which is and going to help us in eradication of the TB. So because the non-compliance of this therapy, modern therapy, which is a well-established efficacious therapy, is because of the IADRs. If the complementary or whatever these the systems of medicine, if they can help in reducing these ADRs and associated non-compliance, many diseases can be tackled very easily. So I thank you for your input in this angle. I'll take the questions to the yoga to the Dr. N.J. Patil and Dr. Balram Pradhan for further their comments. Dr. Nitin Patil.
Yes, sir.
Yeah. So now we have a various views from the.
Sir, can you able to hear me, sir?
Yeah, we are able to hear you.
Yes, sir.
So
as the medical, as TN Suresh sir was telling, now the Ayush posting has started. We are very much fortunate. I think one of the very rarest of the rare colleges in India to started the yoga part of the curriculum for the physiology in 2012 itself. As we are already ready for the integrative medicine in education also, in the practice also. The first year MBBS students now mandatory NMC mandated things also we have did it. In addition to that, we have also did it for the patients integration is also happening. We have an integrative medicine. We are fortunately I have with now Dr. Ravisha sir. He's a medicine HOD. They are all very cooperative, and it's going to be a kind of model. This is the first time even in AIMS it started late. We have started in 2012, and the TM here is very cooperative. Dr. Prabhakar sir and Dr. Ravisha, they're all professor from medicine. We are doing Ayurveda research also. We are doing a yoga research also. In addition to that, we are also trying to come up with a Panchakarma, which is already going to start. We have already got an equipment, and we are going to start. And there is another additional exposure for them. And thanks for the again NIMHANS to take an initial certificate course in integrative medicine. One of our students already joined. She is now in NIMHANS. Dr. Diksha went that. So this is where the humble beginning has started. No, this was the dream of the Dr. H.R. Nagendra. We call him as a Guruji. His dream was to propagate yoga. And recent one of the meetings, the discussion has so happened in Niti Ayog. Probably they want to make this Vietnam model, healthcare model, or maybe a China healthcare model has to be incorporated or maybe implemented in India. That's how the humble beginning has started. I feel there are a long way to go. As we already said, there is one study which we have conducted including JNMC, Belgaum and BM Kankanwadi KLE, where Ayush PJ7 dengue related project, which we have completed involving ICMR part of that. This kind of lot of initiation has to come up in future, and people online or maybe offline, those who are now listening here, this has to start. That's where this is a model where NIMHANS has started, where SVASA has started, and KLE have taken some amount of initiation. Now STHR also taken a lot of initiation. We have conducted one of the clinical trial, multicentric has been done. It has been very clear that because the allopathy people are also there in one roof, and Ayurveda people are also one roof, and also in the yoga people, including medical education expert like Dr. Suresh and team, Suresh sir and team, it is really going to integrate at all levels. Because integration only at a practice level, it is not going to helpful. We are facing a lot of challenges for Ayush interns because they don't have a background of theory and practical. For the internship, they have a theory and practical exposure for other subjects. But unfortunately, when it comes to Ayush systems, they don't have a theory and practices. With the help of medical education department, what now we have made is 30% theory, 30% practical, and also 40% skill application, clinical competence, which we are now implementing. We have made some kind of learning objective, and we have started to implement that in our Ayush systems in interns. That's how they're all humble beginning. Maybe there are a lot of inputs from the expert, and we are taking a feedback, how to go, what to do. Maybe a small amount of study also we have discussed with Suresh sir and team. So that's how I think these are all things to be way ahead. We have to do it. This is the practical experience, being the one of the very rarest of the rare college to have a this implemented model already well in place. So these are all my views, sir. I will now hand over to the Dr. Banappa, sir.
Yes, sir. Thank you. Thank you very much for your input, sir. I have one more questions to your team. That the evidence-based research evidence is required for an integration. It was highlighted by my colleague Dr. Harsha also. That the evidence will definitely facilitate the integration. So what are the challenges or the opportunities or scope for this evidence-based research in yoga towards the integration? So your comment please.
I think Dr. Hemant Bhaiya can also give an inputs. I will start with it. Maybe I will just share my practical experiences. Again, we are very much fortunate to take 2 projects of the MD dissertation from the physiology. Another one was the MS orthopedic dissertation. it's a dissertation main topic where guide was from the department and co-guide from the integrative medicine department. That's what the real integration. Dr. B.M. Hegde, one of the pioneer in the field of integration, being the cardiologist, very eminent personality. He started even long back, but somehow it was not implemented in most of the places. Nowadays, Dr. Arun HS, our HOD of orthopedic, got a chance for us, and we have did, and we got a very wonderful result. That paper also we have presented in a conferences, national conferences. Now it's in the process of publication. That's how I feel the integration, only evidence-based what is there. It has to start from all level. It is the undergraduate level. It has to start from a postgraduate level. Only projects, if we limit evidence-based to the only projects, it will only again addressing to the higher level, highest level will be very difficult. It has to start implementing at undergraduate level. We have a DEMEDCon, very beautiful concept for the undergraduate. There is a beautiful conference exclusively conducted for the undergraduate. So their small project is taken by the undergraduate. This kind of integration has to start from that level, along with a PG, dissertation kind of thing. And also we have a PhD yoga scholars. So we have a clinical nutrition, we have a physiotherapy, we have started speech pathology. We are trying to do multiple integration. That's where we are trying to incorporate and bring evidence base at all angles. So these are all our practical inputs. Now I will request Dr. Hemant to add on to it.
Thank you very much, Dr. Nitin. We have been doing some research on similar lines. In fact, most of the research that I'm going to show you are the dissertations of our MD psychiatry students, who have done their research projects in the field of yoga. So in this way, if you put a student shows interest, they are directed here. So earlier the yoga center at Nimans was under the Department of Psychiatry only. So yoga is something which is a non-pharmacological system, and therefore it is the easiest to integrate. So therefore I feel that yoga should be the first system which should be integrated, because there will be least resistance. It is later on that other systems of Ayush can be added. These researches show the neuroprotective effect of yoga in elderly people, the decline of the brain, the brain mass reduces with age. But if there are, in this research, the practitioner of at least 1 year, if they had a history of practicing yoga regularly, you can see that the gray matter mass the decline has significantly reduced. This is a review article of 34 studies, on neuroimaging effects of yoga on the brain through neuroimaging studies. And it shows 3 prominent effects on the brain. One is that the gray matter volume increases in 2 areas, that is insula and hippocampus. There is activation of prefrontal cortices, and the DMN connectivity changes the DMN mode network. So these are 3 proven effects of yoga. Now this is Navin et al. Is a BNY student who did his PhD in our institute, and in his PhD he could find that the BDNF, the brain-derived neurotrophic factor, which is a marker of neuroplasticity, improved in depressed subjects, whereas the stress hormone cortisol levels reduced. Similarly, Streeter et al. Have shown that the GABA is the major mechanism through which yoga produces its effects. So the central top-down effects of yoga are through the increasing the GABAergic tone, whereas the bottom-up effects are through the vagal afferents. So these are 2 mechanisms through which yoga works. And on similar lines, we have done research. So Jhakar et al. Is our MD psychiatry student. He did his thesis here. So there is a device known as transmagnetic stimulation device, which indirectly measures the GABAergic tone through cortical silent period. And we could demonstrate through 2 trials, we could demonstrate that yoga practice increases the GABAergic tone in depressed subjects, which manifests as improvement in their symptoms, and they move towards the healthy. And it works better than just a walk. Okay, so this was 7 days pre-post intervention. Similarly, we have shown that chanting of the sound Om, in fact, the ma part of it, the humming part of it, that part of it affects the auricular branch of the vagus nerve and causes limbic deactivation. Now, electrical stimulation of the auricular branch in the ear is a known treatment for depression. So here we are suggesting that these mantras act as a non-invasive neuromodulation technique and do have a therapeutic, effect, especially in the neurological and psychiatric illnesses. So this study was again replicated, and we found that Om and Brahmari produce similar kind of effect. Om also has 3 components, A, U and Ma, and we found that each component, according to Mandukya Upanishad, A is connected to wakefulness, U to dream state, and Ma to sleep state. And what we could observe was that the A caused activation of more of the attentional networks, whereas with U and Ma, it was the resting networks that got more activated. So definitely what was written in the Upanishad was proven here through research. I found that Kapalabhati Pranayama enhanced prefrontal activation. So people say Kapalabhati, forehead shining. And we could demonstrate through FNIRS device that forehead shining means increased oxygenation of prefrontal cortex through the practice of Kapalabhati. So there are various effects on the brain, the neuroplastic effects that we have found even in schizophrenia patients. Various effects are there. We could demonstrate that oxytocin levels increase in schizophrenia, mirror neuron activation takes place, and through that their social cognition becomes better, and therefore so this is ultimately, this slide shows that the integrative medicine department follows in clinical services. It integrates, it also does the same thing in the area of research by giving a hypothesis driven research methodology. Then we have started MD Ayurvedic Manasaroga course from this year in the Department of Integrative Medicine at Nimhans, PhD Integrative Medicine. We have a postdoctoral fellowship for MD Psychiatry Fellows in Integrative Psychiatry. And there is a tough competition for this fellowship. There is 1 seat, and this time there were 12 applications. 12 MD Psychiatry students were competing to get a seat in Integrative Psychiatry, because abroad there is a lot of demand for Integrative Psychiatry. And of course we have started this thing. So these are the number of evidences through which the integration has taken place, whether you call it as patient services, the training activities, publishing textbooks in the field of yoga. Recently we have published Science and Art of Yoga, that kind of a textbook in mental and neurological healthcare, which is in Amazon. If you put Nimhans in Google, you can see that. Then getting funding from agencies, mainstream funding agencies, getting funding to perform integrative medicine research, and of course publishing more and more in this area, so that we have the required evidence base to move towards this direction. So what I feel is that integration should be like a football team. This is the example given by Dr. H.R. Nagendra. So the people standing in the front row here are the people who are center forward and they attack, whereas the people standing behind, they prevent the goal, they are the defense. So the center forward is modern medicine, and the people in the defense are the Ayush systems. They are the people who promote well-being, so therefore we should work as a team together, and that is how I feel that we should move forward. Thank you.
Thank you, Dr. Hemant, for wonderful inputs through these research evidence bases, which are in fact a core driving force if you want to have a integration in a real meaning, because that's the only convincing way. With the evidence, we can definitely go ahead in this direction. So with this, the next question is that about that its implementation, both in terms of that how to go in this rural area. That I got one question, that how can be implemented in rural areas of yoga. Dr. Hemant, can you or any panel members
will answer this?
There was one initiative where Asha workers were trained. Yeah.
Sir, can you able to hear me?
Yeah. Yes, sir.
Yeah. So there is a program called Ayush Gram, which was an initiation from the Karnataka government. There were few projects, 8 or 9 projects have been taken. One of the project is also conducted by Sri, and this program was for 3 years. It is taking Ayush Gram was, one panchayat, what are the various comes under one panchayat. There are there the herbal garden concept, and there are no home remedy concept in that one, and also yoga was part of that. This was a humble beginning. There are projects, among there are a lot of challenges they have faced, but there are a lot of success also they have found. This kind of projects, maybe we need to take more and more and do a actually a large scale studies wherever these are all done. They have tried in a pilot way and they have found some amount of success, and there are some amount challenges also they have faced. Ayushgram was the one of the public oriented or community oriented Ayushgram implementation was the initiation step taken by the Karnataka government. So I now request maybe Hemant want to speak something, so I will leave it to Hemant.
Thank you, thank you. So here, one initiative which already Government of India has taken is establishing the wellness centers in villages in various taluka places. We actually received a project from Infosys where they wanted us to adopt 2 talukas and work towards the model of integrative medicine in those talukas, one in North Karnataka, one in South Karnataka. So basically, in this model, what we observed was that we have to work in close liaison with these wellness centers. It has been observed that the farmers, when they grow their field, in the form of weeds, lot of medicinal plants like Brahmi and various other very useful plants come up, but they are not able to recognize it, and they just throw it away. So in these wellness centers, there is a yoga instructor that is appointed, and second aspect is that they are being educated there. The farmers and all, they are educated to understand the useful herbs, so that they are taught, in our indigenous, the traditional systems, the health was a state phenomena. It was never made into any kind of institution or privatized. So here we have to again democratize this knowledge and spread that awareness that what are the simple kind of herbs that are there in their field that they can use and they can adopt. So that needs that kind of awareness that has to be developed. And for this, we should write research projects to funding agency where we want to work in close liaison with these wellness centers. So this is a good initiative through which we can go to grassroots level. And there was another project where ASHA workers were given some more reimbursements and incentives, and they were trained in small yoga capsules to deliver. So ASHA workers are one manpower who are there at the PHC level. They are quite active, doing a good job. If they are trained on very simple pranayama techniques, simple relaxation techniques in their own language, they can also do that. And but definitely they need more incentives. They want to earn more, and that is why some motivation we have to give them, and this is another way through which we can reach the villages.
Thank you, sir. Thank you. I anticipate that Dr. Harsha is a ethnomedicine person, works with ethnopharmacological practices of this rural population and have worked extensively on this angle. If he has some views, he can definitely contribute in this. Thank you, sir.
Yeah, thank you. And to add one more dimension to the discussion, what we are having today, there are several household practices in our community, especially in the rural practices where the modern medical facilities are a bit far for them to approach. So we are trying to document and maybe kind of revitalize those kind of household practices. For example, the ultimate aim is to kind of pre-primary healthcare, where we want to stop the people to be ill, like maybe some household practices, or maybe if, very small ailments like cough, cold, or fever. There are a lot of practices which were used at our household level earlier days, but now we are losing one by one. So we are also looking into those kind of practices which can be at household level. So I think that can be one of the other aspects which we can look into when we are talking about integrative medicine. Maybe it can be as a preventive also. Like in both aspects, it can work. That is on my take. Thank you.
Thank you, sir. Thank you for the wonderful inputs. I'll pass the question to Dr. Manish with a special reference to its, because the safety is the first thing. Sir, I'll add one approach to reach to the grassroots level, as Dr. Hemant Bhargava already mentioned that there are wellness centers, and to connect it with these wellness centers, there are now the DHR scheme is running on since I think 2015 regarding this model rural health research unit.
So now there are the states are having this MRHRU facilities also, and there are some medical research unit also established in some medical colleges also. So in collaboration, I think these units can also take initiative because they are mean for these MRHRUs are specially mean for the rural health issues. So in coordination with wellness center, MRHRUs can take up some initiative and to bring this kind of intervention at the grassroots level. So this is what I need to add. Thank you, Dr. Manish. Upon this discussion, any comments from any other panelist? Please go ahead, sir. Dr. Hemant or Dr. Pradhan, Balram Pradhan.
Yeah, I would like to add one more thing, sir.
Yes, please.
Recently, the government of India, no, maybe NMC also taken an initiation where MBBS enters need to adopt few of the families. I'm not so sure about the numbers of the family, but they adopt 2 families.
2%.
I think sir can able to add.
Sir, actually, this NMC has come out with each student who's getting admitted into the medicine course, that is an MBBS, has to adopt 2 families from one of the villages. That is community participation. That is, I think it's made mandatory and it's compulsory that they have to adapt 2 families in one of the rural areas surrounding the college, so that they can integrate better with these rural setups, and they can come to know what are the practices being practiced, especially in the rural areas. And I think they'll come to know these local health healers, what do you call? Maybe we have something in them also. So they may be also practicing without evidence probably, but they'll be practicing. They are also practicing. They are local health healers. I think we can integrate with those people also, because our rural folk have got more faith in them than allopathy medicine people probably. So we can train them in a proper way. Probably even they may be of use in the rural areas. That's one thing. And Nitin Patil was talking about Dr. B.M. Hegde. I was happy to say that I was a student and I'm KMC graduate. And in my batch itself, he was given one of the practice as the effect of Tulsi Dala and cough. That was one of the dissertation topic. That was in 1995. So that was the commitment that he had for integrative medicine. But it came out to be really good, the dissertation, in fact. And I'm happy to say that the Nitin Patil is next neighbor to me, even in the hospital, not only here. So we have a lot of integration between general medicine and integrative medicine. And we have on other side orthopedics and radiology. So there's a lot of integration. It is in the single wing. So as Dr. Hemant was telling, no need to cross the road in our hospital at least. So we are in the same roof. So the integrative medicine is totally under one roof and in a single floor and just neighbors. Okay, you can integrate at any time. We don't have any problem at all in our hospital right now. Thank you, sir. These are my few words input.
Sir, I have one more word, sir, to add up to this. No, Ayurveda and yoga are actually not 2 different things. Unfortunately, we have a different councils. When we see the root, no, because this need to be implemented together, maybe at a different level. Because no, if you say the Patanjali Yoga Sutra, no, prayer itself says for the mind management we need yoga, for the body management we need Ayurveda. We need both the things to do sadhana. That's the ultimate goal of anybody's life, moksha. That has been clearly mentioned, but unfortunately we have a councils. That's a debatable topic, but still I feel the community based, we can also consider household, what no Harsha sir and also Manish sir was telling. That's what I'm trying to say. Thank you.
Sir, I just like to add another thing. Dr. Ravisha sir had mentioned about that medical students adopting the family. So whenever we are just trying to promote household remedies for some preliminary conditions, suppose diarrhea. If we are promoting household remedies, whenever we are putting it to expert, the first question comes to us is suppose if household remedies are not working and condition is worsening, then how that lay person will know that. So I think this is the approach. If you were telling that family, if they are adopting, medical students are adopting the family in rural areas, they can easily guide them for approaching primary healthcare center or secondary healthcare center. They can just assess their conditions and whether household remedies are working fine or not, the condition is improving or not. They can also be involved in such kind of activities.
Sir, to add another thing, they will be with this family almost for 4.5 years. So they will know in and out of the family. Everyone they will know. They are very well oriented and they know what is happening in the family. So what are the risk factors which can lead to the family? There are so many preventable things which can be prevented, and definitely they may be of help because they are taking allopathy from hospital to the rural areas there. Okay, not only allopathy, even any remedial measures. So they are coming back and they're learning, and at the same time they are adapting. So whatever they are learning in the medical colleges, it is getting reflected back to the rural areas. That's an advantage of adapting. So these people will go back, and whatever they have learned in medical colleges, they are going to implement at the society level. So that's what happens. That is an advantage. So every family gets to have one doctor, as it is Modi's vision. Every family should have a doctor. So definitely, I think that will come into effect probably. Yes, sir. Yes, sir. Thank you.
Banappa sir, there is a question online. It seems one of the delegate has asked our host of the day, Dr. Nuzat, would like to know. With your permission, she will
Please read
it out.
Thank you, sir. Mr. Prashant has asked that traditional medicine system also have surgical procedures done by rishis. Is there?
We bring back that knowledge and incorporate for humankind.
You use my mic. You continue the same system.
Yes.
Sorry for the technical issue.
Yes, sir. I can. If I'm audible, I will read it through here.
Traditional medicine system also have surgical procedures done by rishis. Is there any way we can bring back that knowledge and incorporate them for the humankind? Thank you, sir.
To this response to this comment, sir, from my side, only the validation of these the procedures, if at all, even surgical also, will be beneficial for bringing back into an integrate into this the conventional system, whatever it is, sir. So I request the other panelists to comment, and this will be a final round of the interactions. Anybody wants to comment?
Can I speak?
Yes, please, sir.
Sir, actually, this is, I think we have taken these things from them only, from rishis only, whatever the allopathy is practicing probably. Rhinoplasty was done by Shushrusha, and they are doing it right now again. And there is a transplant which has been done on Ganesha itself. So there's a transplant which is going on now, isn't it? Only thing is they were painful procedures because some people used to hold them tightly and do the surgery. But only thing is the anesthesia is definitely, yeah, that is a boon to the modern medicine, which made the people painless surgeries. That's the only advantage from the allopathy. But all these surgeries were done by rishis. The same surgeries has been adapted and probably modified to suit the consequences and to suit the probably the needs of this society now probably. So because of the pain, only the pain. So if you are reducing the pain by any way, doesn't matter what you are practicing, because people really practice. Sushis had done 1,600 surgeries, I feel. So he knew 1,600 in that Sushis Samhita or whatever it is. So there were 1,600 surgeries have been explained, and most of them has been adopted. That's all. It's been improvised and adopted probably. So I think the surgeries are done by our rishis. The same thing is being done now also. Yeah, there's little improvisation because the civilization is improved. So that may be the reason. So not that adapting, we are already adapted. Whatever we have learned, it is from them only. So probably it is that.
Yeah, my view also the same, sir. It's already integrated by validation into the modern practices, and we have not lost. At least some of those the surgical procedures, as sir rightly mentioned, are there in practice already with the little modification of this anesthesia technology and all. With this, we have come to the final round of the session. So if anybody have any specific comments on that now to share, I invite them. Otherwise, we'll go ahead with this winding up this session, sir.
Sir, if you permit, just last few lines I would like to say.
Please, sir.
My message to all the new doctors, who are doing MBBS now, Definitely the schedules are very busy. There are so many subjects that you have to study in your MBBS, and it is not at all an easy task. Over that, with the cutthroat competition for PG entrance seat, we know how much burden you have in your head. So we can completely understand your situation. But one viewpoint that I would like to give you is that once you finish your MBBS, you get your PG seat, you do your MD in medicine or whichever branch that you do, and then you come to this kind of a understanding that the patient for which you have been learning all these years, that patient comes and then asks from you that, doctor, can I take this particular system of medicine along with your medications? Or this is a particular problem where I am not completely satisfied with your medicine and I have tried this. So there you will become speechless. So therefore, when if you really are doing everything for the welfare of the patient, and especially looking at the Indian population, then it becomes your inherent duty to understand, what all the patient takes and what happens and how these things interact. So therefore, that interest should be genuine, and the earlier you cultivate that interest, wherever you get some exposure, show some interest towards this dimension, and you will see that there are certain disorders where the integrative approaches will work way better than what modern medicine can do. And ultimately, openness, just remain open. I'm not asking you to do much, but do not close yourself. Just remain open, and you will see that you will end up becoming a better doctor. Thank you. Thank you.
Sir, can I just have a comments on that? Dr. Hemant, sir.
Yes, sir, please.
Hello?
Yes, please. Yes, please. Yes, please.
Sir, actually, it's ideal that you add something into the curriculum from the day one of the MBBS course about integrative medicine. That should be the better thing. But those who are deemed universities, maybe they can change their curriculum, adapt few classes or something, so that as Patil was talking, so start from basics. So as soon as you come into the internship, and you get into the internship and don't know anything about integrative medicine, and you are doing for 1 week or 10 days, I don't think that will really help, because without knowledge of the theory. So better to have few classes or integrate at least some 5-10% of the integrative medicine into the curriculum itself. That could be the better choice, because they will know the basics at least. From there they come.
And earlier the better, sir.
Why somebody what I should do? I don't have an alternative. I have to refer it to Patil or go to him. Then he may help you out, because if that question arises to me, because I have not gone through this curriculum. But what I feel is, I think Indian medicine should start from day one of MBBS. That's what I feel.
Yes, sir. Yes, sir. I completely agree. The earlier, the better, sir. Yes.
Yes, thank you, sir. Thank you. I thank all the panelists for their valuable comments and various important points on the various aspects of the integrative medicine, like education, training, and practice, and taking it to the implementation aspect, that is in the rural population also. To summarize these all the discussions which are happened, research-driven, evidence-based approach for this integration of these the various systems of medicine towards this better patient healthcare, patient care is the need of the hour. Moving from the patient-driven approach to the patient-centered approach, like instead of that having this cafeteria approach where the patient has to decide, that to the patient-centered approach by the panel of experts from the various disciplines, and moving from illness approach to the wellness approach by engaging these wellness centers, implementing these research findings to reach these the major population of the India, that is a rural population. So we have touched upon all these aspects. I thank all the expert panel members for their valuable comments and inputs. I hand over to the organizing team at SDU.
I thank you, sir, Dr. Bannappa sir, moderating this session, and also all the team from ICMR, National Institute of Traditional Medicine. In a short notice, Dr. Hemant Bhargava also spared his time and also updated so many things which is happening in EMHANS. And in spite of, Dr. Suresh sir also, he was busy with another meeting, but still he spared his time, and our HOD Professor Dr. Ravisha sir, medicine, also spared his time. It is happening here. It's a model what I really feel and it need to be implemented in all the places. I thank again Dr. Harsha, Dr. Manish and other team. If I left out, even I thank the director of ICMR, NITIM for his support, and also all the director from the NIMHANS. So I thank one and all. I now hand over to Dr. Nuzat for the final remarks. Thank you.
It was a great discussion of how to implement yoga into academics, public health, and there was also a discussion on research requirements of yoga. So we being the PhD scholars of yoga, we are happy to see the progress of yoga, and we hope the awareness of yoga spreads more and more in the future. Thank you once again. I thank our beloved moderator, Dr. Bannappa Yu, for his presence in the panel discussion, and I also thank our panel members, Dr. Ravisha sir, Dr. Patil sir, Dr. Hemant Bhargav, Dr. Suresh TN, Dr. Balaram Pradhan, Dr. Harsha Hegde, Dr. Manish Barwalia.
We will end the session with Shanti Mantra.
Sir, thank you. Thank you for this opportunity and being
Thank you. Your presence made us happy. Geniuses like you can turn simple discussions into amazing events. We are blessed to have masterminds like you today. Thank you once again. We will end today's session here. Let's join tomorrow at 2 p.m. with the most renowned speakers. The speakers who are going to enlighten us tomorrow are Dr. Shivaram Varampalli, Dr. Prashant Gupta, Dr. K.J. Malagi, Dr. Kashinath Samagandi, Dr. Padmini Tekur, Dr. Satyam Tripathi. Let's meet tomorrow at 2 p.m. We'll close the session by with Shanti Mantra.
Sarve bhavantu sukhina,
सर्वे सन्तु निरामया, सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत्। ॐ शान्ति शान्ति शान्तिः।
Thank you all.